As a member of the UWSP Recreation and Sport Facility staff team, you must always be prepared to respond to a variety of injuries and situations that occur throughout the facility. When notified of an injury or emergency situation, always grab the first aid kit and radio and do a mental check of where the nearest AED is located.
I think they need help. One of them's moving, but yeah, you guys.
Use the radio to notify other staff in the building of the situation and to request assistance in your area. Using the 3B system, make an announcement of code black for severe medical emergency, code blue, minor medical emergency, or code brown for active shooter.
We have a code black in the MAC. All available staff to the MAC, please. Thanks.
As the primary responder, be sure to give clear and concise instructions to any additional staff on scene. These things may include going to get additional materials such as first aid supplies or ice, calling EMS, or assisting with patient care. As you arrive on the scene, check that the scene is safe. Introduce yourself as a staff member and tell them that you are first aid certified and wish to help.
Hi, my name is Mary. I'm a MAC staff member. Is it okay if I help you right now?
Yes, please.
Okay.
While calling 911, stay on the phone until they tell you to hang up and inform them of all details that may be relevant to their arrival on campus.
Can you tell me anything that happened?
Not really. I just want to play basketball.
As you assess and treat the injury, ask the patient questions to determine what actually happened, how severe the injury may be, and to determine their current mental status.
Okay, can you tell me your name?
Maham.
All right, so I'm just going to...
When dealing with blood or any bodily fluids, put on gloves.
have a look at your forehead. Can you...
Before dealing with any secondary injuries, stop any major bleeding by applying direct pressure to the wound with a clean gauze pad.
Mackenzie, can I have your help?
Yeah.
We're going to need to hold her neck, so can you just put your hands right here?
If a head or neck injury is suspected, utilize additional staff or bystanders to stabilize and immobilize the head, neck, and spine.
Some questions?
Depending on your location in the facility, direct EMS to the appropriate doors. Send a staff member or bystander to meet them. As first responders take over care of the patient, they may ask you additional questions or give specific directions. Be attentive and cooperative.
Just kind of keep pressure on the head there, okay?
While EMS may have taken control of the situation, it is important to note that your role as a staff member is not yet complete. In any situation where blood or other fluids are present, use an appropriate disinfectant to clean the area. Any materials that have come in contact with blood, including gloves, rags, wipes, or towels, should be placed in a biohazard bag and taken to the nearest biohazard container. Anytime there is a code black or EMS is called, you are required to contact your direct supervisor to notify them of the situation that has just occurred. Once the patient has been transported or has left the facility, and any biohazard materials have been cleaned and properly discarded, complete an electronic incident report. Incident reports can be found on all desktop computers and iPads in the facility.